Sleep wrinkles are those lines and wrinkles on your face that you see in the morning when you wake up that just weren't there when you went to sleep. And don't blame your mirror. They're real, despite a recent study that questions their existence. I, and enough of you, have experienced them often enough to make it worth our time to talk about them, how to prevent them, and just as important, what to do when you get them. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Sleep wrinkles, yes, they're real, and yes, they're really annoying. Whether they occur next to your eyes in your crow's feet area, maybe even coursing over your cheek. How about over the middle of your jawbone? Even on your forehead? Look, when we wake up and we see sleep lines, we look more tired, we look older. Now, we've all heard the same suggestions on how to prevent them. First and most common is sleep on your back. Do you realize how difficult it is for so many people to sleep on their back and not turn from side to side? Okay, so then there's a technique for people who can't sleep on their back. They have these specially shaped pillows. A little bit like the U-shaped pillow that you sometimes use on an airline to help you sleep on an airline. Did you ever try to use one of those pillows? They're really uncomfortable. Sleeping with those things is no pleasure. Although in theory, it does make sense. They would prevent your skin from rubbing against anything else if the pillow goes around your neck. How about this preventative measure? Put some tape on the vulnerable area, like next to the eyes or on your cheek, because if the tape is there, it'll stabilize the skin so it can't get crunched up into a line or wrinkle. And lastly, increase the slip factor of your skin so the skin will slide over the pillow instead of crunching up and creating lines of wrinkles. Two ways to do that. Increase the slip factor on your pillow by using a satin pillowcase because you just slide much more easily over that. Or you can even increase the slip factor on your skin by using your favorite moisturizer before you go to sleep. It just decreases friction and is more apt to have the skin slide over the pillow rather than bunching up into a wrinkle. So you've done it all. And mirror, mirror on the wall doesn't think you did anything. There they are again. Short of taking out an iron and ironing your skin, and face it, who has time to iron anything in the morning? What can you do? A couple of techniques. First of all, and probably most impactful, is to cause contraction of the skin. And if you contract it and make it more taut, those lines and wrinkles will be actually stretched out. Best way to do that is with cold. So splash some ice cold water into your face. Keep repeating it as long as you can until your face starts to feel uncomfortable. Don't do it until you start to feel numb, but that cold will go a long way. Second way to help here is to do anything that causes a tiny bit of swelling in your skin, because swelling in the skin brings fluid into the dermis and the epidermis and helps just fill up those lines and wrinkles. So the first way involves massaging, but not in the usual way. Not by rubbing back and forth, because I don't like rubbing the skin and stretching it unnecessarily. Instead, take your finger over the line or wrinkle and roll it back and forth like I'm rolling it, putting a lot of pressure on. But of course, use your favorite lotion or cream, whether it's a moisturizer or sunscreen or anything else that you like, because we want to decrease the friction. We don't want to rub on the skin from side to side. We just want to put on the pressure because that pressure will cause a little bit of swelling. Or you can just tap right over the line or wrinkle repeatedly. It does the same thing in terms of bringing the fluid in. So obviously, while the results of these measures make you look better because they help take away the lines and wrinkles, prevention is so much more important than treatment. So if you can try any of the preventative measures that I mentioned today, they may go a long way for you, and certainly that's going to be far better than having to get up in the morning and treat your sleep wrinkles. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.